for program policy and services, as well as our grant partners at HCP, Carol Dioy, Senior Associate for Public Policy. I would like to introduce and welcome Fidel Monroe, Senior Program Manager for Long-Term Care at the New York State Department of Health and Mental Hygiene, to say a few opening remarks. Fidel?
Good morning, everyone. I'm Fidel Monroe, and I'm the Home Care and Hospice and Palliative Care Liaison for Long-Term Care Emergency Preparedness at the New York City Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response in the Bureau of Healthcare and Community Readiness. My bureau has a specific mission, and that is to support the New York City healthcare system to respond safely and effectively in emergencies. To do this, we align much of our work with the healthcare preparedness capabilities driven by the Department of Health and Human Services, Administration for Strategic Preparedness and Response, which is referred to as ASPR. Educational offerings, such as today's forum, are made possible by the funding dollars provided by ASPR's Hospital Preparedness Program, HPP, which allows us to focus our efforts on building and maintaining a prepared healthcare system, advancing the development of the New York City Healthcare Coalition, strengthening regional coordination, and ensuring the healthcare system can maintain operations and surge to provide acute medical care during all hazards emergencies. So how are these dollars used to benefit the home care sector? With the support of the associations, we offer sector-based activities with the goal of providing fundamental education and planning initiatives aimed at strengthening the internal capacities and capabilities of the home care sector, and increasing its ability to partner with public health and the community to improve mitigation, preparedness, response, and recovery in disasters. Today's topic will highlight the U.S. Department of Health and Human Services emPOWER program. This knowledge that will be gleaned from today's presentation is invaluable towards strengthening each agency's comprehensive emergency plan. I thank you for participating in today's forum and acknowledge that the healthcare system in New York City has strengthened with the addition of the home care sector to the New York City Healthcare Coalition, which continues to grow stronger because of your involvement and feedback into our programming. The home care sector is a valuable member of the coalition because the sector brings its experience serving a vulnerable population, and the sector is tasked with keeping this population safe in their homes should a disaster occur, or working with New York City agencies and other coalition members to relocate and repatriate this population should the need arise. The sector's inclusion in the coalition is integral to supporting the New York City healthcare system. I encourage you to use opportunities such as this forum to advance healthcare readiness to meet future hazards in a changing world. I look forward to working with you as we build on the successes of your sector and its involvement with the New York City Healthcare Coalition. Thank you. Over to you, Carol.
It's actually going back to Ariana, but I do want to say thank you, Fidel, for all your support with this project and our other projects.
You're welcome.
Yes, and I echo that. Both associations work very closely with Fidel and appreciate her ongoing support and guidance. You're welcome. So a few housekeeping items before we jump into today's agenda. All participants have joined muted and will remain muted throughout today's presentations. Today's forum is being recorded and will be made available, as well as the presentation slides. Both associations will have today's forum and slides posted on our websites. We strongly encourage folks to participate. Please utilize the chat, as members of the HCA and HCP team will be monitoring throughout. And lastly, we'll be requesting your participation in a few polling questions, so stay tuned for that. Next slide, please. Today's forum will focus on electricity dependence planning by home care agencies in the emPOWER program, an ASPR and CMS tool. We will be hearing from Tamer Hadid on emPOWER emergency planning de-identified data sets, as well as Barbara Citarella on electricity dependence planning in the emPOWER tool. Both associations will provide the latest updates on current emergency-related issues, and we will be closing today's forum with an open discussion. Both associations would like to acknowledge and thank the New York City Department of Health and Mental Hygiene and the entire team, Fidel, Darren, and Matt. We really appreciate your ongoing partnership, support, and guidance in this project. Next slide. Perfect. Again, this project was supported by the Department of Health and Human Services Administration for Strategic Preparedness and Response under a grant that both associations have received. We just would like to note that today's content is solely the responsibility of the authors and does not necessarily represent the official views of HHS or ASPR. So with that, I'm happy to pass the mic over to Carol from HCP, as Carol's going to kick us off with a few polling questions.
Thanks a lot, Ariane. And again, thanks, Fidel. So we're going to be using Poll Everywhere today to get a little engagement from our participants. So to participate in the polling questions, you will need to open a web browser and go to the link on your screen. It's pollev.com/CarolDio549. But an easier way is to just grab your phone. I know you're probably on your computer, so you can use your phone separately and text Carol Dio, that's Carol with an E, 549 to the phone number 22333. You can do that at any time. You can do it now before we get to the question or when we get to the question. You do not need to identify yourself. You'll see on the bottom here a little screen grab of what it looks like if you're on a browser. It will ask for your name. You do not have to identify yourself. We just use these responses to see who's out there and to get engagement from our friends that joined us today. So once the poll question is launched, that's when you will enter your answer. So for our first poll question, we'll give you about a minute and a half to answer this. And again, the information to get your responses in is right there on the top of the screen, either the web browser or the text messaging. You can also scan the QR code that's there. So you're going to choose the answer that best describes your primary enterprise, whether your primary business is a LICSA, a CHA, a hospice, a fiscal intermediary, if you're a payer, or if you're an other emergency management partner, such as an association or a government entity. You'll have letter answers as soon as I launch the poll. So far, the LICSAs are responding. You guys can see those responses on the screen, correct? Thanks, Ariane.
Yes.
Yes.
You're always dependent on technology. I like to double check. We have some partners responding. Hospice, welcome aboard. We love working with our hospice partners at Hip Caney's. Give another half a minute here. LICSAs are taking over. So we have about 70% LICSAs today, 5% CHAs, a handful of hospices, and of course our partners that join us for these webinars. So great job, everybody. And if you didn't get in on this one, you can still get in on the next one. With that, we're going to move over to our speaker. Has Tamer joined us, Cynthia?
I believe so. I think I saw him on there.
Hi, I'm here. Can
There
you
he
hear me?
Hi,
is.
okay,
Yep.
great. So Tamer Hadid was recommended to us by Fidel to add to this conversation today, and we're so glad he was able to join us. He's the Assistant Commissioner of the Bureau of Healthcare and Community Readiness for New York City Department of Health and Mental Hygiene. Are you going to need to share a few slides, Tamer, or are you just going to talk?
Yeah, I have a short slide
Okay.
set. I can't share them right now, but if
Yep,
you make
I
me
stopped,
host,
and Cynthia will make sure you're a co-host so you can share.
You should be all set. Can you see the
Okay,
share?
thank you.
And I see folks asking about the poll. We will put that address back up for the next poll question.
Okay, how's that?
Looks great to me.
Okay, excellent. Thank you guys.
I'm sorry, this is Barbara. I am not still seeing a full screen for the PowerPoint. I only see, am I the only one?
No, I can see a full screen.
I can
Yeah,
see
so
a
can
full
I.
screen also.
Yeah.
So can I, Andy. Yep.
I can see
So-
also.
Okay.
Barb, maybe Dina can get on the phone with you in the background to get that,
No, I'll work on it. I
get
got
that
it.
straight. Okay.
I didn't know if it was just me or everybody else.
You're one of our speakers. We want you to be comfortable and be able to see. Thanks, Ariana, for pasting that in the chat for us.
Okay.
Take it away, Tamer.
Okay, thank you very much. And so thank you for having me. My name is Tamer Hadi. I've been working with the emPOWER data for about 8 years now or so, and so have a little bit of experience with it. However, I should say that our next speaker, I believe Barbara, is going to do this topic a whole lot more justice than I am, and I don't want to steal any of her thunder. And so I'm going to speak to you specifically about the aspect of emPOWER that we use as a public health jurisdiction to reach out to individual folks. And I think Barbara's presentation is going to focus more globally on what the program is, how it can be used, even in aggregate in some of the publicly facing resources that you have available to you. And so my presentation is going to be very short, and then hers is going to be a lot more extensive and probably more useful too. So getting into it, the emPOWER program is a program that came up several years ago to give public health jurisdictions the ability to outreach to at-risk folks who are electrically dependent, but it's not exclusively electrically dependent folks, but also folks who are on dialysis, whether at home or in a facility, as well as folks who receive home health services. And so basically, so whenever we request this data, they give us a group of people in New York City who are basically within a certain number of categories of durable medical equipment, like ventilators, or as you can see here, O2 concentrators, cardiac devices. It's something like 12 different categories, as well as people who are dialysis patients and the others. And so in New York City, it turns out to be around 60,000 or so folks that we get when we request these data sets. If you wanted to, and Barbara's going to touch on this more in depth, but there is a publicly available map where you can go to this link, and you'll have this later, and you can kind of play around with this map where they give you different filtering capabilities to get down to even the zip code level, and then toggling some of these different filters along the top here to get to certain numbers of people within the jurisdiction and within the boundaries. So to give you an idea of the numbers we're talking about, and this is Medicare only, so it's missing the entire Medicaid side, but a lot of these folks are dual eligible. So using the publicly available data, you can get down to the county level and then look at kind of some of the totals. And you can see here, overall in New York City, there's 1.3 million Medicare beneficiaries. And actually this number should have been updated. It's really, this is just the electrically dependent folks, but if you add in home care and you add in dialysis patients, it goes up to around 60,000 folks citywide. And then this is a little bit of a busy slide, but this gives you an idea of all the different categories of service that we get when we request the data. And so on a monthly basis, we get an aggregate set, and this is what it looks like. So you can kind of get some ideas of numbers. In the whole city, there's approximately 10,155 patients that get dialysis in a facility. You can see at the top left here, and then you going to the right, you can kind of see oxygen services, home health services, at-home hospice services, and so on, going down to the DME categories: cardiac, ventilators, BiPAPs, and then the third row is the rest of them. what you see here, masked zip codes in city, what they try to do for privacy purposes is at the zip code level, if there's less than 10 people, they automatically make that number 11 so that we're not kind of identifying any particular areas within a zip code, just a privacy setting. So some of these numbers may be a little higher than what they should be, but it's a fairly accurate representation. We consider from a planning perspective that ventilator patients are the most at risk, and we've discovered that this number 2348 that you see here is really actually quite far off. We've discovered that there's far few invasively ventilated patients that are at home due to some of the billing codes getting mixed up on the Medicare side, so that there's kind of a bundling of folks, some folks who are using something called an oscillating vest, others who are non-invasively ventilated, and then also invasively ventilated. So it's kind of a conglomerate of people. So that number is a little bit not accurate, and we've discovered that by doing exercises and actual door knocking in some cases to kind of understand this population a little bit more in New York City. So what we do as public health, when let's say we see a coastal storm, is going to probably hit New York City with some relative confidence, we start a process of requesting the data from ASPR, the assistant. Actually, they've changed their name, Administration for Strategic Preparedness and Response. We request the data. It comes with name, date of birth, addresses, and the kinds of devices they use. For us to be more accurate with our messaging, we then use that data and we add an evacuation zone to it. So if their addresses are in zone 1 and 2, and we know that the storm is going to be affecting those zones, we just focus in on those patients. And then it does not come with a phone number, which is really unfortunate. And we've tried to work with them. Apparently, Medicare does not collect phone numbers because of the fear of scammers getting access to the data or getting access to the numbers. At least that was the reason I was given. So we actually have to do a reverse phone lookup on these records, and there is a cost involved, but of course we pay that. And it's not tremendously expensive. It's like $1 and change per person. And we often get back maybe like an 80% success rate of phone numbers. So there is some data lost, unfortunately, but that's the imperfect nature of the data set. And then once we get the phone numbers, we start doing different messaging to the community, whether if it's 72 to 96 hours out, it's usually just a hey, preparedness focus, make arrangements now. If you can evacuate, that's great. Get a go bag together, make sure you have your batteries and backups ready, or get a dialysis treatment now before anything might happen to the facilities you go to, and give them any other resources we have. And we'll disseminate that via a voice message, a text message, as well as, no email in this case, because we don't have emails for the folks. So it's text and phone. Once we have a little more idea of the cone of confidence of the storm becomes a little more clear, and maybe if there's a true evacuation notice issued by the mayor, then we can send out another message with more specific details on, okay, if you need assistance evacuating, here's what you can do. And usually we'll have a homebound evacuation operation set up and ready, so that when you call 311, you can request that evacuation assistance. So all of those things have to be put in place before we send out that messaging. And then we'll try to do an after storm safety check as well, because in certain instances, depending on certain triggers, if there's a lot of power outages, I think the trigger is like 5,000, we may start doing a canvassing operation. And so having folks responding to our texts if they are in need of assistance, either by calling 311 or 911. And then also we can use the data to kind of target canvassers into certain areas, knowing that there's like let's say a NORC exists that went out and we know that there's 20 or 30 patients from the list that we got, we can kind of prioritize canvassing towards those buildings to make sure that those folks are okay. Just one last example I would want to give you is during COVID, the emPOWER program allowed us to do a special data set, and I actually wish they would do this for us all the time. They allowed us actually to request the entire Medicare data set, all 1.3 million New Yorkers who are on Medicare, with the exception of people who they knew were already vaccinated. So they took those folks out. And so we requested 10% at a time due to data use agreements. Eventually, we got to about 950,000 New Yorkers who we had no record of being vaccinated. We ran them through our community, our citywide immunization registry to kind of to weed out more folks who are not vaccinated. And then we actually had people, we did a reverse phone lookup, and we gave these numbers to a whole team of nurses who started making calls to encourage folks to get vaccinated and even create appointments for them and offer them in-home vaccination. And so I wish I had some of the stats for you. They did a ton of calls. It was, I don't know, the success rate was not super high percentage-wise, but they certainly reached out and successfully vaccinated a lot of people based on this program. So we found it to be a success. And so really that's the gist of the individualized data set. And it's something that we plan on using every coastal storm season. And of course, if there's an ad hoc power outage caused by whatever reason, which happens a lot more frequently these days, we can try to start, try to message this population whenever we can. By the way, we know that this population is also very, very prepared in general. And so in some cases, this messaging is kind of an overabundance of caution, but nevertheless, we want to make sure that they have access to the resources that are put in place by the city should they need any additional assistance. So
that's fantastic. And the vaccination outreach is fabulous. If you can just stop sharing, and while we do questions so that I can just prep for there you go. There are some questions in the chat. So, Maggie wants to know, can you speak to why the data does not include Medicaid recipients? But I do think that Barb is going to go over a lot of that too in her presentation. So just everybody know that you'll get a lot more emPOWER information and energy dependence info from Barb.
Yeah, I mean, the difference is state versus state runs Medicaid and feds run Medicare. And so they are trying to work on combining them so that when I make the request to the feds for the Medicare, they're also including the state that you're in Medicaid also, but they haven't quite completed that project yet.
That would be great to add. Ariana, do you see any other questions that we might need to get to now, or do we want to wait until, because Barb has a lot to talk about?
We can wait, Carol.
Okay. And Tamara, we hope that you'll stay on to add to the conversation. We're going to have open discussion at the end. I know you're probably pretty busy, but
No, I'll definitely stay on.
okay, great. Thank you. Thanks for being here.
My pleasure.
So the poll everywhere information is in the chat. Can you see the question, Ariana? Yeah.
Yes, we can.
Again, with the switch technology, I like to double check that I'm sharing the right screen. So the information for entering the poll is in the chat, and it's also on the screen. Again, the easy way is to just go to your text app, punch in 22333, enter Carol Dio 549, and then you'll be able to answer the question. So for our second question, we want to know where you guys are practicing. We know this invitation went out to New York City providers, but we do invite other people to come along. So your options will be, yes, I provide home care services in the 5 boroughs. no, I only provide home care services outside the 5 boroughs, or I am not a home care provider. So it's just A, B, or C this time. It's like everybody's in New York City almost. Wow. Usually we get a couple outside the city. That is great. I'm gonna leave it open 10 more seconds. Give folks a chance. And there'll be one more poll question. At the end, that'll be a free text question. So if you didn't get on yet, you can still play with us on that one. Great. 89% home care providers in the 5 boroughs. So thank you for sharing that with us. I'm going to turn it over to Andy Koski from HCA. We work a lot together in emergency management, and he's going to introduce our keynote speaker for today.
Great, thank you, Carol. And I really have the pleasure of introducing Barbara Citarella. I've worked with Barbara over the years and just a wonderful person, very knowledgeable. She's the founder of the acclaimed company RBC Limited. They're a healthcare and management company specializing in improving organizational operations. We've used them for many things on Medicare and Medicaid, working with providers, and they really have a lot of information, more than just emergency preparedness. She's the only internationally recognized expert in disaster preparedness for the home care and hospice industry. In addition to consulting in all areas of healthcare, Barb has worked extensively with local, state, federal agencies with regard to business recovery planning, protection of personnel, infection prevention, everything that relates to emergency protection, emergency preparedness, and more. For most of 2019 to 2022, she worked extensively with government agencies for the COVID response. During 2023, she edited and revised multiple response guidance documents. So she really is the expert, not only in New York State, but nationwide on emergency preparedness. And Bob, thank you so much for taking the time out of your very busy schedule to present today.
Hey, Carol, I think Barb is kicked out of the room or off the line. I'm not
Well, she
sure.
could be rejoining. I know she was having technical problems. She
Okay,
does have her own slides to share, so I can't pull those up right now.
okay.
Dina, is there any way you can call her? Oh,
Somebody's coming back in on a phone. Let's see.
Yes, I'll try to give her a call.
okay.
Thanks, Dina.
Barb, are you back with us?
Maybe we can, she just sent an email, been kicked out, trying to get back in.
Okay, great. Thank you. I have
Yeah.
my email closed for the presentation, so thanks, Andy.
Yeah.
Yeah, she wanted to share her own slides, so I don't even have a copy of them to pull up for her, but she can certainly send them to me. And we can share them. Sorry for the little delay here. The chat questions, we will make sure that those get answered over the course of the presentation or when Barb has time for questions afterwards.
Barb, is that you? I think I heard her come back in. I see her. Barb, can you hear us?
Technology is great until it doesn't work, as I'm sure you have all experienced over the past 4 years.
She's got to fully load so I can make her a co-host.
Carol, should we look at the chat and see if any questions we can at least answer or look at right now?
Yeah, Tamer's still with us, so Tamara, if you want to just address the couple of questions that we had. One was for a licensed agency, New York City evacuation zones must be listed on each emergency form. That is probably a question for Barbara. Protocol for vent patients. Can you speak to that at all, Tamara? There's Barbara. Yay. We can't quite hear you yet.
She's muted.
You're muted, Barb. We'll get you on.
There she
Can
goes.
you hear me now?
There you
Yes,
are.
we
Oh
can.
my gosh.
Always happens at that moment, right?
Whoa.
Feel
All
free
right.
to share your slides at any time. Hopefully you heard the wonderful introduction that Andy gave you.
I did not, but thank
Oh.
you, Andy.
He's been going on and on and on the whole time you're gone.
Oh,
Barb.
I love Andy. So we have a secret romance going. All right, now I'm really worried. So let's see.
You should be able to share, Barb. You see him? See the share screen?
Yeah, I think we might have to go with my notes on this one because let's see. Can we do a slideshow? We good?
Yeah, I see the PowerPoint with your side slides, but if that's how you have it, that's fine.
Yeah, this is round one.
Okay.
Excuse me. So because this one deals with a little bit more about home care and just the electricity dependence, and then I'll bring up the ASPR one.
Okay,
And just
great.
so that everybody knows, I am actually speaking on behalf of ASPR. So everything that's on here has been approved by ASPR before I'm allowed to share it with you. So
That's
first of
great.
all, thank you so much for doing this. This is an interesting topic. emPOWER is an amazing tool, absolutely amazing. And Fidel, thank you so much for including home care. The industry has struggled for years to be included and to be part of disaster preparedness, because we know we play a really important role. So thank you so much.
You're welcome.
And Tama, if I said your name correctly, you put it in a nutshell exactly what the purpose of this program is. So you have a lot to offer, and so please feel free. I'm a very relaxed presenter. Jump in anytime you want to add, to talk about what it is you're doing. That would be awesome. I would really appreciate that.
Sure will. Thank you, Barbara.
So let's see if we get. So I want to just talk a little bit about the power grid. We're going to hear a lot about the power grid in the incoming year as we begin to look to go more to other types of energy as opposed to electricity. And also because I don't have an attendance list, if everybody could kind of just put in the chat room who you are and what organization you're from, so that as I'm moving through the slides, I can tailor that to meet your needs. So our grid, which is actually a very aging grid, is divided into three major sections. So for us, east of the Rockies, we're called the Eastern Interconnection. Then we have the Western Interconnection, which is the Pacific Ocean to the Rocky Mountain. And then we have the Texas Interconnected System. So think of it as different systems for a reason, because if we had an overutilization of power, the whole grid would go out, and we certainly don't want that. But each of these three sections are then, they filter down into smaller local electricity grids. So I just want you to kind of be aware of what we have. So this is what a microgrid would look like. Microgrids become very important when we have disasters and we have events, or we have something specific going on, to understand how it's used and the different types of energy that comes up through the microgrid to your towers that we all see. You know, we have them all local, the power towers, and then across the country. So at the bottom of the line is what we use every day. It's what we have in our home. It's what we have in our business. It's solar or renewable or the windmills. And then also if you're using solar, we're storing it. And then also if we lose power, sometimes we use generators. So how many of you that are on this program, just write into the chat room, have actually lost power for more than 2 days? I'll just be curious. Because when we get into long-term and short-term effects, we can see the importance of maintaining our patients and our clients when we lose power for a significant period of time. So when we lose power, understand that what we're losing is, of course, not our lights, not the ability to use our devices or watch TV, but, you know, we can't pump gas, we can't recharge our electric vehicles, we have issues maintaining our food supply. So it really is important, in fact, in spite of the fact that this is an aging energy source. We have not spent a lot of time in upkeep on it, but it does have a significant impact to the way that patient care is delivered. So this is just an example of the reasons why we lose power. You all know it. I think Tamer said it great. You know, he talked about power outages, when they use it ahead of time, but we don't always get it ahead of time. It's not always a notice event. Sometimes there are no notice events. We're familiar with hurricanes. We're familiar with the wildfires that occurred out in California. That's actually where I got most of my experience in learning about emPOWER and the power grid, putting people into shelters, all of those incidents that we occur. And we've seen more of them within probably the last 2 years, a lot of wind, a lot of rain, a lot of storms. And so that affects just so many things that we do. So as we said, we know that the power grid is aging. So based on a study that was in 2016, just to give you an example of the size and the capacity of what we have in our power grid, that it's made up of 7,300 power plants, 160,000 miles of high voltage lines, millions of miles of low voltage. And then, of course, we have the actual use of electricity. It's really important that you understand that electricity just doesn't happen. It's not like we're Ben Franklin standing out there with a kite waiting to get electricity to power either our house or our cars. Electricity is produced by our conventional sources of energy, such as natural gas, oil, coal, and nuclear energy. So it's not a standalone. So it's important to remember that as we're thinking about the push on the use of electric vehicles and moving towards a higher use of electricity, that it is in fact generated by the conventional sources behind it. It is not a standalone source of power. So it's really important to understand that. So as we think about that, and we look at solar panels and solar battery packages, again, remember that electricity is not standalone. Now, I know because I live in a country where we lose power all the time, but over the last week or two, how many times with the storms and we had the earthquake and Tamer, I'd be interested to hear you talk about what did you do when we had the earthquake, if anything, that we hear all the time, we're having a storm, just be prepared, we may be without power for a long period of time. So how often do we hear this? It's pretty common over the last 5 or 6 months. We've had a lot of rain, we've had a lot of storms, we've had a lot of wind. So we hear this all the time. the top states, the 5 top states that have power outages are Michigan, Ohio, New York, Texas, and California. So those are the top 5 states that tend to lose power. And interestingly enough, California is the highest user of solar energy. So we know that we have short-term and long-term effects when we have a power outage. So when we have a short-term effect, you know, we really are looking at maybe 12 hours or 24 hours. And so most people can survive on that. It's not comfortable, but we could get by that. We know that food in the refrigerator will not last 24 hours. But when we get into long-term, that's when we begin to see the issues from a healthcare perspective. And when we get into day 2 or 3 of without power, that is when the emergency rooms and the hospitals begin to see the patients that are electricity dependent for their medical devices show up in the ER. So when we move into the long-term piece, we are seeing much more concern about chronic illnesses, access to portable water, sanitation, disruption of medical services, the ability to continue to provide care, access medications, pharmacies may be closed. I think the best classic example of what happens when an area completely loses power is Puerto Rico after Hurricane Maria. Everything was shut down. And so when we look at those types of things and access to renal dialysis, that's where we begin to get into these issues. And even after the event is over, we know that we have people that have had these chronic illnesses that then have exacerbations.
Bob, this is Andy. Sorry to interrupt you, but are you advancing your slides? Because on my screen, I'm still on slide 1, and I'm not sure.
Yes,
whether-
I am advancing them. And I'm glad that you said that. So do you want me to go out and come back into this again?
You can just do slideshow. If you hit slideshow on top, Barb, I thought you were aware. That's why I didn't say anything.
No, I'm glad you said, okay, so give me,
You said you were going to do it with your notes, so I thought you were aware. If you
no,
hit
I have slides and I'm sorry. So again,
slideshow on the top left-hand corner of this screen that's showing, if you hit slideshow,
okay, my top of my screen shows differently.
okay.
I don't have anything that says slideshow. Wow,
okay.
this is getting to be a real fiasco, isn't it?
That's okay. That's all right.
No,
We-
let me
we
go
wanna
back
see what you
out.
have to say. So
No, because it's important that they
If-
have the slides.
if you just close your slideshow and reopen your stop your share, and then get your slideshow set. I apologize for not saying something. Thank you, Andy, for speaking up.
No, Andy, please, yes, always. So
You
let
said you were
me,
doing notes, so I didn't realize.
no. So let's do it this way.
Yeah, you still have about 45 minutes left, so we're good.
So maybe, all right, so now,
If you start your slideshow before you share.
no, I know.
We joked that I was going to have to sing and dance in the breaks, and
You may have to sing and dance. I think she just got kicked off again,
oh no.
I think.
Yeah, and we don't have her slides. Because they were approved by Asper. She only shared the PDFs with us. Which I could pull that up and at least we'll have that to look at. Maybe I will do that. And then she
Yeah.
won't have to worry about this. Does that sound reasonable?
I'm not sure.
Sure.
Now, when she gets back on, let her know that I'm just going to share the PDF. Okay, because I can't watch 3 things at once,
Okay, Carol.
as much as I'm trying to. Okay, can you see that, everybody?
Yes.
Yep,
Awesome. Okay, so when she comes back on, we'll just do it this way.
And Carol, can you just zoom in a little bit? If you can,
Possibly.
I think it's on the bottom right-hand corner.
Thanks.
You're welcome. Thank you.
Getting smaller instead of bigger, though.
go plus, yep, hit the upper one, there you go.
Yeah, it's I got people and
Just waiting to see, she's not coming back in yet.
apologies to everybody. And while we're waiting for it, just a reminder, this session is recorded and will be available on the HCP Emergency Management website and HCA's website. New York City often distributes the links to the programs as well. New York City DOHMH, we're thankful to Fidel for all her outreach that she does with these programs.
So Carol, while if she doesn't come on right away, I know there was a question from Bridget about, is there a protocol for vent patients? And I wasn't sure whether Bridget meant a protocol that each individual agency should have, or whether the city recommends a protocol. If the question is whether the agency should have a protocol, I would say yes, they should have a protocol. I don't know if you want to add or address that, Carol.
I don't know that I can. I'm not aware of the regs for event, or maybe the question poser can clarify what they meant, if they meant an agency protocol or an ASPR protocol.
Yeah, can someone clarify the question a little further? Because I'm not sure what you mean by protocol for vent patients.
Yeah, Tamara can probably help us.
And then the next question was, for a licensed agency, New York City evacuation zones must be listed on each emergency form in the file. So it's a question. So if you're Alexa, on your emergency form, and I assume it means an emergency form for the individual patient, should the evacuation zone be listed? And I would say it's a good recommended procedure. Whether it's required, again, that I don't know.
Yeah, I think Barb's going to cover the requirements, and I think she's back in.
Great, okay.
I just clicked on her, but I'm not sure where she went here in my list.
Barb, if you can hear me, I've pulled up the PDF of your slides so that we can just use this as a reference. You'll just have to ask me to advance when you want me to advance. This way we don't have to worry about the technology as much, because we want to focus on what you have to say.
Yeah, Carol, she actually just sent you the PowerPoint for, I guess, this part of the presentation.
Okie dokie. I don't even have my email open.
Yeah.
Okay, we'll do.
Am I okay? Can you hear me?
I can hear you. Are you okay with using the PDF, and I'll just advance for you?
Yeah, use this one, and then for the other one, bring up the PDF that I have together for, I just sent you, the one that and I might be able to pull that one up myself.
Okay.
Okay,
I
so,
only had the PDF, so just tell me where,
yeah, and God, I apologize. This has been
that's
an.
okay. Just
Yeah,
tell me
we're-
where you need me to be on
I
this.
keep getting knocked off.
Tell me where you need me to be on here.
Okay, keep going down to power outages, right? Keep going, keep going, keep going, keep going. Right there.
Okay.
So after the wildfires in California, the most power companies put together what is called a public safety power shutoff, or PSPS. And so the whole point is, when the power grid is becoming too overwhelmed, that they have the ability to shut down certain pieces. It is not a federal requirement, so it goes state by state. And they are supposed to give notice, but it doesn't always happen. Next slide, next slide. So here's an example of what happened in upstate New York in 2024. The power company, the National Grid, sent out that they were going to be doing some maintenance. And this particular power company covers upstate New York and Massachusetts. That's what it would look like. Okay, next slide. So we know what healthcare, and I'm going to go through this really quickly so we have plenty of time to talk about emPOWER. We know what happens, especially for home care and hospice, if we don't have access to power. We can't access the electronic medical record. We can't store vaccines properly. We can't have some medications may be under a lock. But we also know that there are other reasons why the electricity makes a difference. Even in our office, it makes a difference of how we work. I don't know about any of you, but in the consulting business, if we don't have power, we don't have email, we don't have the ability to talk. I mean, you could use your cell phone if you wanted to use it up, but it is really affects patient care in the long run. The longer they are without power. And for us in home care, we do have some requirements and regulations. So the next slide talks about identifying those of our patients that are electricity dependent. So what I'm going to ask you right now, and you can put it into the chat room, do you have a mechanism? Because you are supposed to. It is not your job to go out to emPOWER and check to see if your patient is on there, because you're not going to get that information. All that information out there at the public level is de-identified information. You are not going to get anything specific. However, what is your process? Do you have one now? Because we are responsible to. We have, by regulation, a classification process for our patients and transportation levels. Next slide. So this is just an example of what goes on every day in home care. We have electricity dependent patients of all types. We have children, we have elderly people, we have people in their 40s and 50s. And emPOWER is so important for us to begin to identify it. But as a home care agency, we're responsible for doing that. That's our job, and for hospice as well. Next slide, please. So in the New York State requirements, and this is the DAL number, when under emergency preparedness requirements for home care, which comes off of and based off, and you all remember this, the 2016 CMS final rule that we had talked about for years coming, a very unique ruling from CMS, because it was the first one in the history of CMS to cover 17 providers. Emily, thanks for telling us that you have a plan. And hopefully we'll have time later and you can actually unmute yourself and talk about it. So based on the CMS regs, which New York State follows very closely, and I'm actually very glad that they do, we are in these regs called a facility. They use facility for all the 17 providers. And so in this regulation, next slide, please. And I have emboldened where we have to identify patients that are dependent, electricity dependent, and patients that are dependent on ventilators, and then we have to classify and use transportation levels. Now, what comes up with this is we do it on initial assessment, but do we do it every time we do a reassessment or every time we go in there and we notice a change? So that we are required to do that. That is our regulation. So next slide. So here are some questions for you. Sometimes, especially if we're an inpatient, and we may have some hospice inpatient, to get into the medication room, there may be electronic keys. Do we have a backup plan of how we're going to get into that room or get access to the medications? Do you instruct your patience about turning off all the equipment so there's no surge? And do you know, have you identified where there are free Wi-Fi locations in case we need to charge? And we did this a lot during the wildfires in 2018 in California, which was in the northern state. We actually set up charging stations where people could come and charge. And then we had a few long-term care facilities that were solar powered that allowed government people and people who needed to recharge their equipment, their medical equipment, they allowed them to come and do that. And do you in your office also have items that you can use as backup for charging? So there are items that are, the brand name is Halo. You know, you can charge it. It has multiple ports. You can plug it in. I have a larger Halo that if I lose power and if I run out of gas from my generator, I can plug in something like an electric blanket, or I could cook something as long as it's not high power. So those types of things. But here's a question for you as we go through this. Is electricity a social determinant of health? Now that turns us around thinking a little bit, but for the people that can afford to buy generators, not everybody can. So for me, in dealing with housing right now, I'm working with a lot of government leadership on housing. And is electricity a social determinant of health? I think it is. Be curious to see what your comments are in the chat room.
Absolutely, I agree with you.
It
there.
is. I believe it is. Next slide, please. So then we look at what are the alternate power solutions. You know, if you ride out into Midwest and the northern part of the United States, you will see miles and miles of windmills for energy. But solar energy has become much more interesting. So let's go to the next slide. So have you ever had any experience with solar energy? And Tamara, if you have any information you want to add to this, again, please jump in. And I can stop anytime. Just speak right over me. I'm good. And do you think there's a role for solar energy in an event? Now, here's what is very interesting. So during Hurricane Maria that hit Puerto Rico, everything was wiped out, no electricity whatsoever. And what happened is we had a lot of people from the United States, from universities, go with battery packs. Now, battery packs can last for 3 hours. And so they would use that intermittently with people that had high healthcare needs, because every single renal dialysis center was shut down because there was no power. And remember, because of the culture of Puerto Rico, they have a high incidence of diabetes and renal dialysis. Now, the issue that has plagued solar energy is that it's expensive. So if you wanted to run your whole house on solar energy and be off the grid, it would run right now at this moment in time between $80,000 to $100,000 because you have to store your solar power somewhere. So hopefully as we become much more sophisticated in it, but solar energy, of course, depending on where you live and how much light there is, can really play, even those solar packs for the battery packs for 3 hours can play a very important role in what we do when we lose power. Next slide. So this just really is a slide that talks about how it's going to affect your business. Sometimes when we lose power, we lose data that we can't get back. It can damage our equipment. And it also begins to increase our operational costs. So the next slide is really just my contact information. Feel free. And if we could put up the Asper slides, which is in a PDF format, it will be a little bit easier to move forward.
Yeah,
And I'll stop and
this
say
was a
any
key-
questions. Do we want anything we need to address in the chat room while we're doing that?
Laura or Ariana, if you could help with that while I'm loading the other PDF, that would be great.
Not the handout one I gave you,
That's what I have, the one that
no,
you
all right, let
sent-
me see.
The
let
one
me-
that you
let
emailed
me see.
wasn't it because I asked Laura
Yeah.
to check on that, so.
Let me
we-
see if I can bring my own up.
Okay, that'd be great. Yeah, I forwarded it to Laura so she could,
You need to enable me to share.
It's there, Barb. Do you see it?
It says host
Co-
disabled.
you should have a share
Oh,
screen.
no, it says co-host on me. You don't see it?
Do you have a share screen button on the
Oh,
bottom?
there it
it
is. Yep.
Yay.
Okay. So I also want, let me just do one thing here. And now I'm gonna just. Weird, this is just not working well today, guys, but we'll move along. Let's move along.
Do you have it okay, or do you need me to pull mine up? You got it?
I think I should be able to move these right along.
Okey-dokey.
Yep, I can.
Yay, you got this. So we have about 25 minutes before we want to cover.
It's fine.
some things. Okay. Just
It's
want
fine.
to know.
So I just want to talk a little bit about the behind the scenes of the emPOWER program. First of all, I am in awe of Kristen Finney, who is the person who's been responsible for this show. And I call it a show because this program is just incredible. She's instrumental in the development. She's been from day one. I've worked with her before in the past, and she is pro home care. Just want you to know that. She's a pro home care woman because her mother works in home care. So every time she's in my audience and I'm speaking and she comes on next, we tag team really well. So Kristen, thank you, and thank you for this excellent, excellent program. So why was it created? First of all, it was created in 2013. The Administration for Strategic Preparedness and Response, which Tamar said was a new name, and it is for us. We got to bump up the ladder in the chain of power. We used to be a little bit lower, but now we have a whole new department. This was created in 2013, and we've always worked, when I say we now, I'm talking about ASPR. We have always worked very closely with CMS. And so based on some of the issues that we had seen as far back as Hurricane Katrina, it was decided that we would attempt to put this program together. This program came under the Obama administration, and the person that was in charge at the time of ASPR was Dr. Nicole Laurie, who is a brilliant, brilliant woman. And it was a pleasure and an honor for me to be working with her. So the original purpose was really, and I am going to read some of my slides here. You can look at what's on the screen. I have some other notes here, that it was really launched to be looking at claims data. All of this information is based on claims. So it's not like people are entering patients into a separate database. emPOWER looks at all the Medicare claims, and that's how they pick out who needs to be able to be included on the list. And originally, it was really just for electricity dependent DME. So then we began to expand it in 2014. We began to look at chronic renal disease. we began to look at other types of services that would be disrupted with the power source, and these patients would show up at the hospital. So that's what it was. By 2023, so every year this program has increased and we've done different things. By 2023, we began to develop, and now that is occurring, that you can create data sets of what you want to look at. It's not just one thing or the other. You can look at high-risk data sets. And Tamar talked about that earlier. And he gave you a very good example of how they use that. And so it became a little bit more sophisticated in how we could break down geographic areas. So when we look at what are we seeing, what does emPOWER really entail? So we're looking at 50 states, 5 territories, again, based on Medicare claims. Now, if the patients happen to be dually eligible, you will get Medicaid information, but they have to be dually eligible, which means that there's a Medicaid portion from the states that do not get included into this information. So it looks like at this point, and when you see those curvy little lines besides a percentage in statistics, that means more than or less than, we're not really sure, but we do believe right now we have about 33% of the emPOWER population is dual eligible, which means that they have both Medicaid and Medicare, or may have another type of program, disability Medicare, those types of things. So back in 2018, as a pilot, we brought in the federal program of the Children's Health Insurance Program, CHIP. So that's a pilot program. We are still looking at the data on that. And again, the purpose is to give the information to the public health agencies, to the state emergency response organizations, to city emergency response organizations, so they have the ability to quickly grab this data. So you will see as we move through the slides, there's some pieces that are restricted and there are some pieces that are public. But the whole purpose of adding CHIP was to begin to get the emergency responders to look at a pediatric population. And so every year we have added different components. So again, looking at this, the left side tells you what it includes. So all of the claims from Medicare, A, B, and C are included. Anybody who is in a personal residence with Medicare A, B, C, or dually eligible, and anybody who is claiming for DME and may not be Medicare, but still has an insurance claim, we may get information, but it really is based on Medicare claims. So most of this is Medicare data. It doesn't include nursing homes, doesn't include assisted living facilities. It doesn't include any of the private insurance pays, no TRICARE from the military, and it doesn't include anybody who only has state Medicaid, no other insurance, or anybody who only has the state CHIP program. That is not included in this data. So again, you can see this program is incredible, but again, it becomes more sophisticated with every year. The goal is to include everybody. That is the goal. Now, again, thinking about how people work in the community, we could have people that may be Medicare eligible or dually eligible, but maybe somebody donated to them an electronic wheelchair or a scooter that they're not making claims on, but they're dependent on. So those people won't be in that database either. So here's how they look at data. They look at it, and again, and I can't say this enough, it is Medicare claims data. And dually eligible, Medicaid will come in if it is a dually eligible. So they're looking at, as you could go down the whole list: ventilators, enteral feeding machines, suction pumps, IV therapy, electric beds. Then they also have looking at renal dialysis in inpatient facility. Remember, we have a lot of people who do renal dialysis at home, oxygen, all of those types of equipment. And then you'll see, I think you can see my cursor. Over on the right, we have home health care services, and we have at-home hospice care. Now, when we're talking about home health care services, those Medicare claims would be for Medicare certified. Those would be the CHAs. If you're a licensed agency and your patient happens to be dually eligible, Medicare and Medicaid, then your patient would be included in the data. But again, you are responsible for knowing who your patients are under that DAO and have a list and be able to provide that readily to your local emergency responders and planners, and encouraging your patients to sign up with their power companies. That's not mandated. You can ask them to give you permission for you to do it, but that is your responsibility. So what emPOWER has done now, which is new, instead of looking at each thing individually, standalone to accrue data to pass along, they now do at-risk combinations. And we saw that earlier from New York City when both people were talking about their program, that now we have the ability to fill in little blanks. And I'm going to try and do that without losing you again, and hopefully without losing power. But we continue to grow the ability to get different data. So now you can plug in what you want to look at, what pieces of it. So if I want to look at home care, do I want to look at who is on a ventilator getting home care, or who's a pediatric patient getting peritoneal dialysis, who would probably be on disability and Medicaid? So there are different ways of looking at this. So emPOWER has this incredible interactive tool. I might go through all the slides first and then come back to this and open the tool. So if I screw up or I get disconnected, it'll be at the end of the presentation and we won't care about how the slides go. But
Yeah, we do only have about 15 minutes, Barb, before
I'm just gonna do this. Everybody, you have this, you can click on, you can do it. The public information is the power map. Let me just see if I can do that. So if we go into the power map, here you see it. You can pick a state. So let's pick New York. I'm going to pick my county, which is Dutchess. And I want to see electricity dependent. And then you come down and here's all the zip codes in the county. Okay. Now let's see if I can get rid of this. And if not, we go back to the slides. And if I can't get rid of it, we'll do the slides. So let's see. And if somebody else can get rid of it, that's fine. I don't get to see all of these things. So let's see if we can minimize that. Go back. Let's go back right here.
Yeah, I'm seeing your slide.
You're seeing my slide.
Yep.
That's because I'm not.
We're still seeing your slides. So
Okay, so can you move them for me?
can I move them for you? No, it's from your screen, Barb.
I know, but you can turn over as co-host and take them. Can you do that?
I can't, it's from your computer. I can't,
Okay,
I can reshare. So you just need to pull up, click on your PDF on the bottom and pull that back up so that you can advance them. Otherwise,
can you see them?
yep, I see HHS emPOWER program, slide 7.
Okay, perfect. Thank you, baby.
You're welcome. You're welcome.
So that piece is public. So let's talk about this. How do we access the data? So we have what I just showed you. You can go in, you can look at the program. It's not for individual providers. This program is for public health agencies. You can see this here. Gee, this is really not working well today. Let's go back.
Yeah, you have 2 PDFs open now, I think.
Oh my lordy, lordy. Guys,
Can you see the minimize the minus sign?
hold
right
on a
there?
second. We're gonna go back in.
Do you want me to share mine?
Nope, I'm gonna go back in.
Alrighty.
Here we go.
Someone asked if there was any clips, but I think it's the cicadas are coming on us now.
Know what it is, but most of these people have heard me present before. We have never
Oh,
had this kind of
All
problem.
the tech.
So you have it up right, number 9.
No, you're not sharing your screen right now.
My God.
So don't click on your links when you're sharing your PDF because that's not showing to us. So just stay on your PDF. It'll be a little smoother, I think.
Are we good?
Here it comes. There we
All
go. Slide
right.
7. There we go.
All righty. That's where we were on. So now let's look at the data tools.
Great.
So we have the map where that's public information on accessing the data is really for your public health emergency agencies, your healthcare coalitions, electric company. It is really not for individual providers because you're not going to see your patients out there. And you are responsible for getting and keeping track of your patients. So now we have which is new, the emPOWER REST service. emPOWER REST service is representational state transfer service, which allows the public health agencies, the emergency preparedness people to take this information that's out there and layer it over their own local information to better define who and where the patients are that are electricity dependent and at risk. This is brand new. You can go and click that link. I'm not doing that, but that's what the purpose is, to be able to continue to assist giving data sets. And that is through this new program, emPOWER REST, representational state transfer. So each state can get the information. Now this is interesting. So if anybody has Alexa on, you might want to shut it off right now because we're going to be saying Amazon Alexa. We now have developed and are continuing to work on using AI. And this is an Amazon Alexa program. And it is open to the public, so they say, which means you can go and look at it. But the data is actually only for public health agencies, healthcare coalitions, and emergency managers. It is voice controlled. So you can ask Alexa to give you the data as an emergency response person, as a planner, to get the information you need. This is like so cool. This is amazing. And this is an example of how emPOWER keeps moving forward. So again, you can ask it, you can ask questions, you can get it to give you, you can ask a quick question as to getting de-identified totals in a specific area, always of Medicare A, B, and C. That's what the information will come forward to as A, B, and C. And then they have the emergency planning data set overview. Again, this provides monthly information. This is restricted. It is, again, for public health agencies, healthcare coalitions, all of our responders. And it gives information by zip code, county, Medicare beneficiaries, based on the claims, to again look and identify. And you can break this down into what you want to know. Excuse me. You can break it down by DME, essential services, enteral feedings, IV therapy, combination of that. So it is for the use of our emergency planners when we are lucky enough to have, quote, a planned event or a notice event, but it's extremely beneficial when something happens that's unplanned. It's useful through the whole emergency management cycle. You heard that earlier before I presented. Mitigation, preparedness, response, recovery. Those are not new words for home care and hospice. We've talked about this before. This is part of your disaster plan. We use emPOWER through all of these pieces. And then we also use that data to anticipate. So every time we look at specific at-risk populations, if we know there is something that's going to occur, or we're watching something, if we're watching wildfires, if we're watching snowstorms, we had significant snowstorms up in the Syracuse and Buffalo area last 2023, 2022 with no power. And emPOWER was very helpful in getting National Guard and resources out there as quickly as possible. And in the middle of the screen is just an example of if somebody wanted to pull specific data, but multiple data, you know, O2 services, BiPAP ventilators, by using information by this data set, they're able to do that. These are just stories that are examples of how it works. Situational awareness, life-saving evacuation. We've all been through this with all the different hurricanes. Carol, how much time we have on the meter?
I was just gonna ask you to wrap up so we can just get to a few questions before we do our updates. So that was great that you kind of came back to what Tamara presented with the oxygen dependence and stuff. So
well, he did a great job on showing exactly how it works. And this is the theory and the purpose of the show.
I love it.
And I call it a show because emPOWER, every time I see it, it's just amazing. So people can read through this. These are just examples of how we used emPOWER. And as I said, my experience in working with emPOWER during it was in the 2018 wildfires, where I think we lost 58 people, thousands of acres, and it was the first real test of how we were going to use emPOWER. So these are up here. You can look at those at your will, but it's an amazing tool. And then we have the resources. You can go out and trainings. There are resources. There are FAQs. There are fact sheets. The web training, all of the resources are here. You can click them on and you can get them. They're in your handout as well. And the new training is on replacing DME and prescription drugs, because we've had a problem with people getting their medications when the pharmacies are out because of electricity. And then here is the other training resources. We'll do questions. This is the team of ASPR. Kristen Finney is the director. She's been the director from the get-go. That's my team that I work with. I present on behalf of Kristen whenever she gets tied up someplace. And that is the end of the presentation. Thank you so much for bearing with all the tech issues. My sincere apology for that.
It worked out.
Come back here and how about questions?
Yeah, I'm trying to I got the chat up, so I'm gonna, I'll turn it back to Andy unless Andy wants to take the chat questions. I'll turn it back to him in 1 second. We had just a couple. While you were trying to get your tech back up, Bridget wanted to know if there was a protocol for vent patients, and we weren't quite sure if she meant protocol that agencies need to have or protocol that the the government has, so if she wants to unmute herself and clarify that question. And then you know what was cool thing in the chat, Barb, is that agencies are helping each other, and that's what,
I saw that, but
you
that's,
know, that's the
that-
beauty of a
that's-
forum. Right? Is that we help
That's
each other, you know,
professional,
somebody
yeah.
wanted evacuation zones and somebody else provided, and somebody else wanted a map and somebody else provided. Andy posted the DAL link for everybody. So that was really cool to see. I just have to scroll by all the folks that
Yeah,
entered.
Carol, Bridget has unmuted. Bridget has unmuted. So
Okay, go
what
ahead,
do you think?
Bridget.
Yeah, we primarily take care of pediatric ventilator patients. We were very well prepared for Hurricane Sandy, which was our true test, because here on Long Island, where our base is, everything was out. But going back to that, this is a New York City webinar. From what I understand, most of our patients don't lose power because the grid is underground. Is that true? And then also, does New York City or the federal government or New York State have a specific emergency protocol to follow for ventilator patients? We have our own protocol and we're doing very well with it, but is there a specific protocol?
That's a good question. I don't have an answer for that. I don't know if your power lines are underground.
Well, in New York City, they are.
They are, yeah.
Okay, I don't, and the issue with underground is flooding sometimes.
Right, yep.
Okay.
Or
So,
an earthquake like we had recently, that could probably disrupt.
yeah,
the
that might
underground
make a
lines.
difference.
Yep.
Okay.
I don't think anybody's immune to losing it. I do think that there are people that are in better places about it. As far as New York City guidelines for ventilator patients, we do have New York City Department of Health on, and so maybe they know. And if not, we'll get an answer for you.
Yep.
As far as state regulation, in home care, we do not have that, except to identify who they are, have a plan to evacuate them, making sure the electric company, and I always suggest you connect with your Office of Emergency Response and let them know who your patients are and keep that updated.
Okay, and which we do. Thank
Yes,
you.
I'm sure you do. Home care does a really good job on that. So
And then, you know, hooking on to that, Carmela had a question about licensed agencies having to have evacuation zones in the client packet. Is that a requirement, Barb? Alexa?
it is a requirement, and it falls under a very general. So if your patient is in an evacuation zone, that needs to be part of their plan of care, that they would, be listening and be able to evacuate. And then again, part of our regs is if the patient refuses to evacuate, then the agency has to explain to them what the dangers are if they don't. And then I always suggest, if it's at all possible, that if the patient is refusing, we have some kind of little agreement sheet that outlines exactly what the dangers are, and the patient just acknowledges and signs that she recognizes and she's taking responsibility.
Right. And then
Bob, I would just also add, which is common sense, is that if there's an evacuation, obviously you will have contacted the family, friends, neighbors, just to see whether or not they're aware of this and to get them to also work with the patients.
Absolutely. That is part of the reg, Andy, as part of having every patient has to have a disaster plan. Yes.
That's great. Does anybody have any other questions for Barb? I think she's going to stay on for the rest of our discussion. But if anybody has another question, you can unmute yourself now. We do have about 115 people, so.
And where is everybody from? Are we all from home care?
Yeah, the registrants, we ask questions when they register. So it's Lixas and Chads. I think I sent you the breakdown of the registrants, and then we also get the breakdown of folks who came. So we'll have that afterwards after we do some analysis of the.
If anybody wants to unmute and ask a question, this is your time. Please feel free. And again, we apologize for tech issues. I've never had that happen ever, and I've been doing presentations for a long time. It was karma. It was kind of spooky.
Like I said, maybe it's the cicadas. I don't know.
I don't know. Is it full moon? Maybe it was Alexa.
Yeah, maybe. So thank you, Barb. I'm going to turn it back over to Andy now.
Great, thank you, Carol, and good, thank you, Bob. Despite the technical difficulties, I think you made some major points that are very important. And as Carol has said repeatedly, we will post, we'll post the slides and the recording, so you can go back over them if you'd like. I'm just going to go over a couple of quick things, and we should do this very quickly so there is time to any other issues that come up and to answer questions that we didn't have time to go over before. So as you know, the eclipse came and went. And we've, a lot of us did a lot of preparation for it, particularly if you were in the area that was really affected by it. And, so I just want to go over a couple of things that I've heard from members, and we'll be hearing more as we go on across the state. One is that a lot of the home care providers did notify the staff and patients ahead of time, which is part of emergency preparedness, obviously. They also provided education for staff and patients. A lot of them rescheduled patient visits to a different day of the week or to an earlier part of the day. Staff were encouraged to limit travel during the day and, on the eclipse. Staff were told to basically stock up and plan ahead for food, water, fuel, medications, and also their patients were told to do that. And a lot of the staff did check, a lot of the agencies did check on their priority patients to make sure they were going to be taken care of. And again, to maybe front load services. Some of the challenges, particularly outside of the city, was that traffic was congested in certain areas, maybe not as bad as we expected, but it was still bad. And some folks had it difficult to get to some clients. A lot of agencies canceled visits on the day of the eclipse. And looking back, they felt that they really could have done the visits because things didn't get as bad as they expected it to be in the sense of traffic and so on. And they had to reschedule appointments, which again was part of, emergency preparedness. Some of the lessons that we heard from people that they learned was that the long lead time of notifying staff led to no incidents or concerns. And again, a lot of the agencies, we were doing a lot of education. Each of us have done programs on this. A lot of the counties did programs, and I think people had plenty of time in advance to prepare for this. And again, I think it paid off. It wasn't like it was a storm coming up the coast. We have 24 hours to develop your plan or to put it into effect. We had plenty of time to plan for this. And I think that it really helped folks. Again, I think some of the folks felt that they overplanned and that they could have seen patients on the day of the event. And I think they maybe had some concerns about, they spent a lot of time doing this that they felt may have been for naught. But again, this is emergency preparedness. You're preparing for an emergency. You don't know if it's going to happen. You hope it doesn't happen, but that's part of the preparation. Anybody else has any information on how they plan for this, feel free to put it in the chat, and we will have some time later on to discuss that. Again, thank you so far for that. And the only other topic that I'll mention again is, as you're aware of, Change Healthcare had the cyber incident about a month ago. A lot of our agencies, particularly the licensed agencies, but also the CHAs, were greatly affected when it came to submitting claims, getting prior approval. We had a lot of members who were owed a lot of money, $500,000 and more. Change Healthcare did have a loan program. Medicare did do some advance payments for the certified agencies. I have not heard from members in the last week or two as to whether or not there are still problems continuing with that. I mean, the press seems to indicate that there is some continued issues with Change Healthcare. There was actually an article in one of the things that I get saying that some of the data is now being sold to outside parties. So again, if anybody has any experience recently, feel free to put that in the chat and we'll have some time to discuss that. And Carol, I'll turn it back over to you.
Okay, I've also lost my Zoom screen, so hopefully this is now showing COVID and influenza for us.
Yes.
Yeah,
Okay,
it is.
thanks. Thank you. So It's fun that there's not a lot to say about COVID-19 anymore. That's cause for celebration. The Department of Health had a webinar for providers last month, and the bottom line message from that webinar was COVID is now to be treated just like other respiratory illnesses. That was reflected in the update that came out on March 1st for guidance on respiratory illnesses, COVID-19, flu, RSV. They're all kind of lumped together now, and that is really, really good news for everybody. Keep in mind that that guidance that CDC came out with, per Department of Health, does not apply to healthcare workers. Same old guidance is in place for healthcare workers as far as returning to work. I think everybody's used to the routine by now at that point, and our numbers are so low compared to where we were. I don't know that this is really an issue for anybody. Just in comparison, at our max of Omicron in January of 2022, COVID-19 incidence was about 400 people plus per 100,000 population. And now we're at under 2.5 people per 100,000. So cases are way, way, way down. So if anybody has questions on that, there's still the couple of DOH guidances out there, but nothing new has come down the pike. We have met with the Department of Health a couple of times and asked, when is the new healthcare guidance going to come out? And I think they're just waiting for CDC to do something, because New York State and New York City have been following CDC right along. And if Fidel, if you have any inside intel on that, feel free to jump in at any time. Masking remains the same. Flu masking procedures are in effect if a person is not vaccinated against flu. But as far as COVID goes, you have to go by what's happening in your community, or if you're dealing with a high-risk patient. People still ask about staff screening for COVID-19. It was, I don't have the date in front of me, I apologize, but DOH had come out with a notification that passive screening was fine. Passive screening means you have posters, you have emails that you send to your folks to let them know what are the symptoms, what do they do if they have symptoms. So that is passive screening. You let the folks decide when to tell you that something's going on. You do not have to ask them questions every day. That's been for quite some time. So you can wind down any active screening programs that you have. Real quick on influenza, the most important message that we have for providers today is that on April 16th, the New York State Department of Health sent out a notification to everybody regarding the healthcare personnel influenza vaccination report. Everybody's anticipating it. It's usually out by this time of April. DOH had anticipated opening in the coming weeks, and there is a delay in that, so it's going to be still a few more weeks. They have assured us all that there will be ample time to complete this report, so they're not going to release it on one day and expect you to have it done on the next day. Just make sure that you keep gathering that information, because believe it or not, there are still folks that are getting vaccinated against flu. I do have a question in the chat about masking. If you want to unmute yourself, Maggie.
Yes, hi, thank you. So I'm with Nurse Family Partnership in New York City. And, for forever, everybody was screening and masking. And then for a window of time, we weren't masking as much, but I don't believe the New York City Department of Health has lifted that protocol for our nurse home visitors in the field. And I've been getting a lot of requests from my own staff about when can we stop masking, because, we work with a fairly low risk population, and the nurses are basically saying it really interferes when you're trying to do some work with infants and toddlers around all kinds of stuff. And so I told them I would be attending this and that I would ask, because when the state was encouraging in the wintertime that people in healthcare facilities, et cetera, strongly recommended masking, I did the same for our program as well, because half my staff had COVID very quickly over the winter. So I just feel a little bit confused about what we're really expected to do.
I do not know of any special New York City requirement that requires healthcare providers to mask up. other than the state saying, use your local incidents as a guide if you have a spike in infections, or if the provider has symptoms, or if the patient has symptoms, or if the patient is immunocompromised. I do not know of any New York City specific guidance. Andy and Fidel and Ariana.
Yeah, I think the city did have one, if I remember correctly, and I may be confusing it, but I think they did have one, but it sort of expired a number of months ago. And
Right.
so, and then, and again, if Tamir or Fidel have any other information, feel free to chime in.
Yeah,
So then we
Tamara
go,
had to drop off.
okay.
I
Yeah, I'm
can,
pretty sure it expired, and so that's what we go to what the state's requirements are, or the federal requirements.
yes, that's what we've been following, the state requirements, but I can particularly look into that. So yes, we do follow the state requirements.
Okay.
Yeah.
So this
That's
is
great.
This is Barbara.
Yes.
So the state came out with a recommendation because of RSV and
Exactly.
and some of the other items, measles, etc., recommending that when providing direct patient care, you wear a mask. Now, in saying that, my viewpoint on COVID is probably a little different than everybody else's because I get to see other types of information. And the one thing that is known is that not everybody's reporting who has COVID because they're self-testing at home.
Yep.
So I would still recommend when you're dealing with direct patient care that you wear a mask, and also be cognizant of the fact that almost every single person, at least 90% of people who have had COVID, whether they recognize it or not, the data is now showing the long-term effects of COVID. We can call them long haulers, but there's a whole set of new symptoms coming out related to long-term vertigo,
Mhm.
related to only on the right ear ringing and loss of hearing. So it's for me, it's just too risky
Right.
not to.
Yep.
And so
Right.
that, the recommendation to wear a mask because of the increase in respiratory diseases,
Yep.
I think should be what we look at. That's my,
Yeah, no, I appreciate you chiming in because you see it more globally sometimes than we do. I think Juanita, I'm losing screens too, but somebody had a hand up. If you want to just unmute yourself and ask your question. I just have a couple more points and then we're going to open it up to the whole floor. So
I know, I just want to go back to the person who was asking about the masking. Did that answer your question or help you to make a decision?
I think I agree with your sentiment. I also hear the concerns from our staff because of the particular roles that they have in their work with families. And I guess what I'm going to do is circle back to the New York City Director of Nurse Family Partnership to talk to her a little bit more, because we're sort of falling under their guidelines. And as far as I know, they haven't lifted them for any of us about masking. And I know my nurse brought that up in another meeting where that same person was there. So I think we just need some clarification in the city. And then, and my nurse actually wondered whether she could just acknowledge in her own note that she and the client together acknowledged that they were okay not masking, almost like a hold harmless agreement, so to
Right.
speak, because she feels so strongly about not masking in certain settings.
yeah. Yeah, Maggie,
Maggie,
go
about
ahead.
which, are you with VNS Health or a different agency? I'm just curious.
I'm with SCO Family of Services, and we're a nurse family partnership replication site in Brooklyn.
Okay, thanks.
Maggie, my contact information will be on the last slide. If you could drop me an email once you just decide what you're going to do, just for my edification, I would really appreciate that.
Okay.
Hi, this is
I
Juanita Street. I had my hand up. I just wanted to ask if there was any information on when they would declare the flu not prevalent, because that is one of the reasons why our employees are masking, because if they did not take the flu shot, they have to wear a mask when in the presence of a patient. So I was wondering if anyone heard anything about that.
We have not heard anything with the vaccination report being delayed. I don't know that we'll get a declaration. If you recall, we never got a declaration that flu was over during the entire pandemic. We didn't have a yearly, okay, it's over. So all those folks were supposed to be masking that whole time for flu. Barb, or Fidel, have you heard anything from New York State Department of Health about any flu declaration stopping?
Once they get their data, this is Barbara, once they get their data, then they'll make a determination of whether the flu season is over. And once that happens, we don't have to mask anymore.
And
Should be-
hospitalizations have increased lately. Positive cases are going down, but hospitalizations have increased this for the last reporting session over the prior. So I don't know if that's going to be soon or not.
Yeah, and I would just say that the state does post to the health commerce system every week the influenza report, so you can track it yourself, and that's the data that I think Carol was referencing just now.
Yep, it was. So just a couple more health things, and then we're going to open it up to anything related to emergency preparedness. Reminder that measles is still among us, still on the rise. New York City DOHMH issued an advisory just a couple of weeks ago on March 19th, stressing the CDC information about measles. Anyone who has symptoms or measles cases suspected needs to be isolated, and the provider needs to report that. Avian flu, it's all in the news and the headlines are huge, and the big headline is highly pathogenic. Highly pathogenic with avian flu means it's highly pathogenic in poultry, not in people. So one American case, last time I checked, one case in the US has been reported. So this is not something that everyone needs to go fleeing from. It's just something, again, awareness, right? Like we were aware of the eclipse way, way ahead of time. Look how prepared we were. Something like this is preparing us way, way, way ahead of time, just in case this becomes a problem for humans. It is not a problem for humans right now. And then finally, mpox, also not gone. Vaccines are still available through federal program. The same New York City vaccination website that's been up for quite a while since the first outbreak is still up, and there's still federal vaccine available. And that is the best protection against mpox, which is still occurring mostly in men who have sex with men. So just those three things to be aware of. And now I'm gonna turn it back to Andy to open us up for free for all, whoever has anything to,
We have a statement here from Howard Gerber that says Change Healthcare was hit a second time with ransomware a week or so ago.
Yeah, Howard, thank you. I did hear about that, but I have not heard from any members as to whether or not they've been affected by that. Feel free to put that in the chat box. If I know your agency was affected by the initial attack, but if you've been affected by this one or anybody else, please let us know.
yeah, absolutely. You can always let the associations know, even if you're not a member.
Yep.
Because
And
the
Laura, thank you. Laura
agencies-
did put in a link to
Yes,
the
she did.
article about it.
And we did meet with some of our providers in the northeast region of New York State on Wednesday. Gosh, that was yesterday. Feels like it was a week ago. That said that payments are flowing and there's not really any major payment problems right now to home care agencies. So
Yeah, and Sandra had asked, can Elixir relax their COVID screening policies? And Carol did address that earlier. There was an FAQ that went out, I want to say in October or November of last year. I don't
Yeah.
have the link, but we can get the link and send it out to everybody. And that's where it came into the issue about passive screening.
yeah, so you don't have to actively screen. You can just have signs and handouts for your staff people to make sure they understand what the symptoms are and what to do if they do have symptoms. I'm making a note to have that link and also the DAL that you posted, Andy. You know, all these links that we've had in the chat, we'll try to include those in the follow-up email to folks, which will be later today, we hope. Is there anything else? This was such a great, important conversation about all of our people that are dependent on energy. I'm going to go to another poll question. Maybe this will spark a little more conversation. So here's our last poll question. And for this one, you're going to free type 1-word answers. If you type 2 words, only the first word you type is going to show. So just use a hyphen or just type 2 words as 1 word. We want to know what topics you want to hear about, because we are doing these webinars under the gracious grant that we get from New York City DOHMH. We work with New York State, and we do a lot of activities for emergency preparedness, HCA, HCP, also HIPCANES. If anybody from there is on the line, I'll give a shout out to them. We all do a lot of programs, and these programs are for you. So we need to know what you want. So when the poll's going to open in a moment, this gives you a second to get in. What do you want to know about? Do you want to know about exercises, infectious disease, continuity of operations? You could just type in COOP and we'll know what you mean. Let us know what you want. And this will also be a question on your evaluation. So, oh, look at this. They're coming in. Disasters, COOP, AI. Can you all see that? Excellent. Violence. I think somebody has a violence in the workplace posted recording. Communication is, you know what? Communication comes up in every exercise, doesn't it, Andy?
Yeah.
It
sure.
comes up as one of the strengths, and it also comes up as one of the weaknesses because there's so many aspects to it.
Yeah.
COOP is still a big one. Does anybody have questions about any of these they want to post right now while we're gathered? Because we do have a few more minutes, and we want to
And
hear.
Carol, there was a question about the COVID weekly reports, how much longer they'll be required. And again, I have not heard anything about an ending to that, but I leave it to you or Bob whether you've heard whether the
I'm
state is-
sorry, I'm laughing because it's like, I can't even say soon. We can't predict. I can guarantee you it'll be after the New York State budget, but other than that, I have no answer. We really wish we knew.
Yeah, and we know it's a
COVID pay.
hardship. Yeah, let me just say this, Bob. We know it's a hardship, but you really have to do it. The state does go after agencies that have not done this report and other reports. So when the influenza vaccination report comes out, you got to do it. In the future, you're going to be dinged for not doing it. So we know, again, it's a hardship, but at this point, it has to be done. I'm sorry, Bob.
No, actually, when the state comes on site for survey and they have their list because they've already looked at it, that's one of the things they'll cite. They'll say to the agency, you didn't participate in this, and then they get a statement of deficiency for that.
Exactly, good point. And Barbara Stern is asking about COVID pay. The governor has proposed in her budget to stop COVID specific leave. So we do anticipate that that's going to pass because, as I mentioned, COVID-19 is now, one of your run-of-the-mill diseases. Thank goodness we all live through it right now. Like Barb said, there are long-term ramifications, but for the storm is over. The damage is still floating around there, but the storm is over. So that COVID leave pay is just going to be rolled into regular leave. And then Barbara also wanted to know, Barb Citarella, if you could answer, are the surveyors active?
Yes, they are. Some agencies are behind. I would say that's probably based on your previous survey. If you did not have a lot of deficiencies, we have agencies that are running anywhere from 1.5 to 3 years behind. I do think they're prioritizing.
Okay. Andy, can you take an earthquake question and I'll take the cannabis question when you're done?
All right, Margaret, what is your question about the earthquake?
This was Sonia from Cabs.
Okay.
I know earthquake was mentioned earlier, but I didn't hear a conversation around it in terms of our response to the last one recently.
Okay, so I'm not sure. I think what we were saying was, well, actually, we didn't really say it, but the fact that it was a minor earthquake, I think agencies, didn't do too much, but hopefully they did check in with their patients and their staff to make sure that they weren't affected, and if they were, to take some type of action. But I'm not sure what else if anybody else, took any precautions as part of the reaction to the earthquake, feel free to chime in.
Yeah, I think, Andy, what we were talking about was the use of emPOWER. And
Was
I
the
had asked if
emPOWER.
New York City, once the earthquake had hit, did they go immediately out to emPOWER to check on those people that were electricity dependent? I think that was the,
Okay, thank you.
Yeah, and we also mentioned it with regards to the underground power lines, that someone said they don't lose power a lot in New York City because the lines are underground, but as Barb pointed out, flooding or earthquakes could disrupt those underground lines. But as far as we know, Margaret, there really wasn't a lot of disruption with this quake, which was centered in New Jersey. Does that answer your question?
I was more concerned if there were, or wanting to know if there are particular policies in terms of, even in home care, our aides do work in high-rise buildings on the 5th floor and higher floors with our patients. What would be their response to the patients on these floors in the emergence of an earthquake? Are there policies surrounding that?
you should have policies. That's part of your disaster preparedness plan. That wasn't the first earthquake we had, but it was the largest, and as far as being on the scale. So that should be part of your disaster preparedness plan.
Yeah, when you do your hazard vulnerability analysis, you think about things that could happen, such as an earthquake, and how likely is it, and what is the risk to your business and your patients. So hazard vulnerability analysis can list all those things so that you know what your priorities are. And if you have questions about HVA, we do have some recorded videos. Andy, you probably have them on your page. I know we have them on our page. We focused on HVA in a webinar a year and a half or so ago. So those are posted on our website. We are going to wrap up in 1 second. I do want to say cannabis on physicals has nothing to do with EP. However, I'm going to say you cannot ask about cannabis because cannabis is legal in those over age, what, 21. 21 and over, cannabis is legal in New York State, so you cannot ask. You guys can read these and they'll be linked in your handouts. Andy, you want to talk about what you have coming up with your tabletop?
Okay, so we have a tabletop coming up on May 21st in Manhattan. It's in person. I will say that we are very close to capacity, if not at capacity, and we'll have to get together a waiting list. So if you have not registered, you really need to do it. And there is a link in the handouts. And then just list other programs, other webinars we've given in the past, and it gives the link to those.
Yep.
Thank you, Carol.
Yep, and I just want to put a plug in for our webinar, which is happening on April 30th. HCP is doing a 1-hour program on how to support your staff during and after a crisis, support them in the workplace and personally, because we all know that a crisis doesn't just happen at work, it happens to their families too. So we have some great speakers. VNS is going to present some research, and then we have a health and wellness coach that's going to talk as well. It's going to be a jam-packed hour. So registration is open for that. The link will be in the handouts. And we want to, Ariana, you want to come back to us and thank everybody?
Of course. Thank you,
And
Carol.
I
So,
don't have the QR code on the screen, so I'm going to pull that up.
okay, great. So your feedback is important to us. So please complete today's forum evaluation by scanning the QR code or visiting the direct link. Carol is pulling that up for us right now, and the direct link will be included in the follow-up email. Like Carol mentioned earlier, the associations use your feedback in developing our grant deliverables, so we would love to hear directly from you. And then just to close out today, I wanted to thank our speakers and thank all of you for joining us. We are looking forward to seeing you all again soon. If you have any questions regarding HCA or HCP's grant activities or how you and your agency can get involved, please reach out. Our contact information is listed here in the last slide. So again, just thank you all, and I hope you have a great day.
Thank you, everybody.
I'm going to bring up
Have a
that
great day.
contact information.
Thank you, everyone.
Just- And all of this will be in the handouts as well.
Are we good, Carol? Or am I waiting?
We're
Oh,
good.
there it is.
Thank you.
I'll leave it for just a second if anybody's grabbing it.
I can't believe I forgot to put the QR code on there, and it was the cicadas. They stole
That's
the
okay.
QR.
Thank you, everybody.
And
Have
a
a
heck
great
of a
day.
week. Thank you.
All right, I'm going to sign off.
Yes,
Thanks, everybody.
thank you.